I have I have nothing to say. I'm not going to call her a liar.
And what if the aide said that the bandage was on the left second hammer toe?
Note my objection to form.
Again, I don't know why the bandage was only put on the left second hammer toe if the problem was the right second hammer toe.
And
You've answered the question.
Mm.
what about after February 27th, 2006? Did you think there was a reason to set up a follow-up visit?
There might have been a reason to set up a follow-up visit because if it was indeed an infection, it should be treated.
And did you set up a follow-up visit?
No,
Why didn't you set up a follow-up visit?
because I was contemplating leaving practice at that time.
Can you describe Mrs. Geschwind?
Yes, Mrs. Geschwin was a frail, elderly lady, bedbound, non-conversant as far as I knew. Other than that, her skin was frail, and I knew that I had to be very, very careful in what I did.
You did a procedure. Obviously, there's a dispute about whether it was on the right or the left foot, but regardless of that, tell me what you did.
Well, on that date of service, I saw that the right second toe did not look healthy, and there was questionable infection there. And the skin overlying the toe, there was a break in the skin, and there was some surrounding tissue that was, I wouldn't say necrotic, but devitalized. And I felt before I left that apartment, I had to make some kind of definitive diagnosis of that right second toe, because to not do so would have been negligence. So I said I would very lightly trim away some of the devitalized tissue and submit that in for a Gram stain culture and sensitivity, because I suspected infection. I didn't know for sure if it was, but at the very least she had a superficial cellulitis of that toe.
Now, you said, I will lightly trim away part of this devitalized
Well,
tissue.
I couldn't go too far. I described it as down to dermis, but that again was insurance talk.
So when you said that in your records, you were doing that for the purposes of making sure you were getting paid from the insurance company?
No, well, yes, because that's how we got paid. If I just said I trimmed a corn, you don't get paid for that, but it wasn't a corn.
Doctor, when you went to podiatry school, did they teach you about the importance of keeping accurate records?
Yes, they did.
What did they teach you about that?
That it was paramount to dot the I's and cross the T's.
And that you had to exactly describe what you did as far as care and treatment of your patients in your records?
Yes.
And twice now you've told me that the things that are written on your records are not true, and they're there for the purposes of making sure the insurance company pays you.
Object to the form. You can answer.
I'm saying that how much can you possibly take off that toe when you are dealing with a patient's poor circulation? This is clinical judgment that I had to use.
I'm not
I
asking
could have
about
lopped
that.
off.
No, you can
I could have
answer.
lopped
You can
off
answer.
all that tissue down to dermis, and then what would I have gained? I would have gained a further embarrassment of the circulation.
Okay, but you put in your records that you did that. Now,
I did.
do you agree with me that you're bound by what you put in your records?
No, I object to that. Bound by what?
You're bound to the truthfulness of what you put in your records.
I
As a
object to it.
podiatrist.
Bound,
I'm bound to the patient. I'm bound to not hurting the patient any more than I have to.
So,
Whether I get paid for it or not is totally irrelevant.
so
The
in your
payment
mind,
comes. The payment comes second.
in your mind, it's okay to put down things that are not true in the records.
object to the form.
You know, there are various degrees of anything. There are all kinds of shades of gray.
Do you think this is a shade of gray?
I'm saying in this case, perhaps it was, because if I knew that if I lopped off all the tissue that I maybe I could have lopped off, I knew I might cause further circulatory embarrassment to the
But
patient.
you wrote down that that's what you did.
Okay, so I did.